Bring medication administration record and medications to patient room. Check 5 rights. Right medication, right dose, right time, right route, and right client.
Ask patient about allergies. Always tell patient the name of medication, dosage, indication for use.
Routes of administration. Enteral drugs are drugs that are administered along any portion of the gastrointestinal tract. The main advantage of enteral drugs are that they are convenient and can be self-administered, while the disadvantage is that first pass effect may occur and the effects are too slow for emergency. The enteral drugs that are most readily absorbed are those that are in liquid form, such as syrups and suspensions, while the slowest ones are the tablets, both coated and non-coated. When administering oral medications, assess patient's ability to swallow, check for any contraindications, perform hand hygiene, and always check the expiration date. When giving oral drugs, administer medication at the correct time. Prepare the client in a sitting position to facilitate swallowing and prevent aspiration. For sublingual drugs, place medication under the tongue and tell the patient that the medication is not to be swallowed. Buccal drugs, meanwhile, are to be placed against the mucous membranes of the cheek until the drug dissolves.
Parenteral route. Drugs that are administered through the parenteral route bypass the alimentary canal and are usually done with needles. The first type, which is intradermal administration, is given into the capillary-rich layer just below the epidermis. A wheal is observed on the injection site. The advantage of intradermal administration is that absorption is low, which is good for testing allergies. The disadvantage is that it breaks the skin barrier and the patient may experience a severe local reaction.
Prepare medication, gather supplies, identify site, don gloves.
Cleanse site with alcohol. Inject at 10 to 15 degree angle. Until wheal is formed. Mark wheel.
Sinusulatan ni Ched ng date,
Oras.
ng oras kung kailan babalikan.
The second type is intramuscular administration. Drugs that are administered this way are injected into muscle tissue. Care must be taken to avoid hitting a vein, artery, or nerve while injecting. The advantages are that it is more convenient and can be administered in larger volumes than subcutaneous injection. The disadvantages are its onset of medication is relatively slower and the duration is much longer.
Go. Ask patients about allergies. Always tell patient name of medication, dosage, and indication for use. Identify site. Cleanse site with alcohol. Cool skin dot.
The third type is subcutaneous administration. Drugs that are given this way are injected at a 45-degree angle just below the surface of the skin.
Cleanse site with alcohol. Inject at 45-degree angle.
The fourth type is intravenous administration. Drugs that are given this way directly enter the bloodstream by way of a vein. Most appropriate when a rapid effect is required. The two major disadvantages of IV administration are any error in administration cannot be corrected after the drug has entered the client, and the drug may be irritating to the lining of the blood vessels.
Identify the injection port closest to the client. Stop the IV flow and clean the port with an antiseptic swab. Inject the medication at the ordered rate. This ensures safe drug administration because a too rapid injection could be dangerous. Afterwards, release IV flow. The third route of administration is topical administration. This is the application of a drug directly to the surface of the skin or to any mucous membrane. Drug absorption in this route is usually localized to the skin and mucous membranes of various structures, but may have systemic effects. The types of topical administration are eye medications, ear drops, nasal drugs, and skin medications. The advantages of topical administration are that they are easy and accessible, non-invasive, and have a lower risk of side effects. The disadvantage is that most drugs have a high molecular weight and so are not absorbed via skin or mucous membranes and have very slow absorption.
3, 2, action.
Cleanse site with alcohol. Then, apply transdermal patch.
Action!
Pakaba na lang kasi since malaki yung area.
Okay.
Ito na naman tayo. Sige. Huwag mo naman kasi masyado i-focus na nilalapag talaga ako para kunwari na lang. Magad may nalaglag pa din.
The last type of route is inhalation. This is done when a medication is intended for the nasal mucosa. It is inhaled through the nose. When it is intended for the trachea, bronchi, and/or lungs, it is inhaled through the mouth. The advantages of this route of administration is that it has very rapid absorption due to the huge surface area of the respiratory endothelium, and bronchodilators and inhaled steroids can be targeted to lungs with low levels of systemic absorption. The disadvantage is that bioavailability depends on patient's inhaler technique and the size of drug particles generated by the delivery technique.
Put mouthpiece and mouth and at start of inspiration, Press canister down and continue to inhale deeply.